I am Martin Staunton, reporting for blackbygod.org, the West Virginian. We're reporting today on an unsettling trend when it comes to the opioid epidemic in the Mountain State. The recent figures released by the West Virginia Department of Health and Human Resources, in particular the Public Health Department, shows that the number of opioid overdose deaths are going down in West Virginia. But that is not true with every segment of the population. In fact, for African Americans in the Mountain State, those numbers are going up. Dr. Stephen Loyd is the director of West Virginia's Office of Drug Control Policy. In December, Dr. Loyd revealed the rise in minority overdose deaths, sharing that statistic during a town hall meeting in Kanawha County. Dr. Loyd told those in attendance that minority overdose fatalities are growing at the same time overall overdose deaths are shrinking. Loyd says, while the big picture shows improvement, celebrating progress is premature.
The tendency is, they're going down, our work is getting done. That's not exactly true.
Dr. Loyd adds what is true is the uptick in overdose deaths. They're not limited to West Virginia's African American community.
This is anybody of color, African Americans, Native Americans, Latino, anybody of color. The numbers are either flat or going up, and it's a concern.
And that concern reaches beyond Dr. Loyd's office. Groups on the front lines in the fight against drug addiction are also concerned about the rise in minority overdose deaths. Reverend James Patterson is the CEO of the Partnership of African American Churches, a group helping people of any race who seek to break the shackles of addiction through treatment and recovery. But Reverend Patterson says he was not blindsided by the latest report in terms of the lethal overdose deaths going up for minorities in the Mountain State.
It wasn't surprising and it wasn't shocking because I already knew that. And it's because the word on the street is that white people go to treatment and black people go to jail. So that says that the criminal justice system is basically part of the culprit in terms of why these numbers are so far out of whack or disproportionate. Because it depends on if you are going to, through the criminal justice system, it depends on whether you get referred to treatment or whether you get sent to incarceration. And then once parole happens, what happens at that juncture as well.
The most recent data from the West Virginia Public Health Department was released last August. It reveals the rate of crude overdose deaths and breaks those fatalities down along racial lines in one part of the report. It shows that minorities now make up many of those fatalities. It says for whites in West Virginia, there are 77 lethal overdoses per 100,000 people. For blacks, that number is nearly double that. It's 134 deaths per 100,000. That graph is listed deep in the report. It appears on page 24 of the 33-page document. Black by God is providing the link so people can view that full report. Both Dr. Loyd and Reverend Patterson say another factor in the rise in minority overdose deaths is fentanyl. The powerful opioid is turning up in drugs where users do not expect to find it. They say some dealers are even lacing marijuana with fentanyl.
You look at this population that has, intermittently or chronically used a stimulant, and now you adulterate that supply with fentanyl. Now they use it and they die, right? And a lot of times they don't even know what's in there. No clue. It looks like just like what they've been using forever.
I don't believe that people always know the power and the deadliness of fentanyl, nor do they know that the substance that they are using is fentanyl or that it has been laced with fentanyl. Sometimes people are not aware of that.
And it kills them?
And it kills them.
While the number of fatal overdoses are on the rise for minorities in the Mountain State, and simultaneously, those deaths among their white counterparts are dropping. When you combine the numbers, West Virginia continues to lead the nation when it comes to deadly drug overdoses per capita. Dr. Loyd says no matter the race or ethnicity, Every overdose death kills any chance of helping the victim break free from the grip of drug use.
That's the end of the ball game, and that's the thing that we have to get to, quickest, because we can't treat dead people. So we got to figure out a way to keep them alive, and then we got to figure out a way to treat them. Okay.
We have a lot more information to share about this story. Just read that article right here on blackbygod.org. I am Martin Staunton for Black by God, the West Virginian.